What is Menopur used for in your IVF cycle? Menopur is a combination of both FSH and LH. So whereas the Gonal-F and the Follistim are FSH only, Menopur is a combination of the two. Typically, we take both during any given cycle. They're the two most common types of medications to use. We use FSH and then FSH and LH. But the difference is that Menopur contains LH, whereas Gonal-F and Follistim do not. How many days will you be taking Menopur for during your IVF cycle? Menopur is typically done 8 to 12 days. During certain protocols, we have it start the same day as Gonal-F and Follistim, so you'll be taking it from the beginning of your cycle to the end, that full 8 to 12 days. Sometimes Gonal-F and Follistim are started first, and then Menopur is added in about 3 to 4 days or more into your cycle, but typically they're all taken from the beginning of your cycle on. How is Menopur administered? Menopur is administered subcutaneously via injection. The abdomen is the most common spot to use for your injection. You can also use your upper outer thigh, but it is an injectable subcutaneous injection. What are the side effects of Menopur? So all of the IVF medications typically cause bloating, cramping, foggy headedness, sometimes headache. These are the most common for all of them, including Menopur. Menopur can also feel a little bit different when you're injecting it. So unlike the Gonal-F and the Follistim where you don't really feel the injection, Menopur can definitely cause a little stinging or burning feeling as the medication goes in. It's not long lasting. It typically only lasts for a minute or two, but you definitely feel a burning sensation as opposed to Gonal-F and Follistim where you don't really feel anything. Can you inject your Follistim or Gonal-F in combination with your Menopur? So there are some clinics that show their patients how to actually mix their Menopur injection with their Gonal-F or Follistim so that instead of having to do 2 separate injections, they only do 1. This isn't the recommended way to do it, but some doctors definitely do. So it is something you can ask and they can teach you how to mix the 2 medications. So you're only injecting yourself once versus twice.